Cabbage. Okay, no cabbage. Okay. Hello. Hello. सगळ्यांचा Kumo, kumo. No.
So, good afternoon, all, and welcome to online clinics. Today's topic is acute liver diseases, and in that we have first case of acute liver disease from Dr. Sheetal Kumawat. Dr. Sheetal Kumawat is PG scholar from Motiwala Homeopathic Medical College, Nashik. And then for today's meeting, we have experts from modern medicine, Dr. Pratibha Sonavne. She is gastroenterologist from Maharashtra Postgraduate Institute of Medical Education and Research Center, Nashik. And then Dr. Sachin Patil, he is principal and HOD of Kai Chikitsa Department from Sumati Vaishya Ayurved College, Hadapsar. Then our third expert from homeopath is Dr. Meeta Gharte. She is vice principal from Department of Pediatric, Motiwala Homeopathic Medical College, Nashik. So welcome to all, and we can now start our today's meeting with Dr. Sheetal Kumawat. Dr. Sheetal?
Hello.
Yeah, please share. Yeah.
Is PPT visible?
Yes, your PPT is visible. You are audible. No problem.
Ma'am, shall I start?
Yeah, please start.
Good evening to everyone. Myself, Dr. Sheetal Kumawat, PG Scholar, Part 1 from Motiwala National Homeopathic Medical College and Hospital. My topic of presentation is acute liver disease. Here is the case of 34-year female residing at Adgaon, Nashik, housewife, who was admitted in emergency hospital in IPD on 19th Jan 2022 and discharged on 22 Jan 22. She came with the presenting complaints of epigastric region gripping pain since 7 to 8 days. The onset was slow and progress was gradual. Character was gripping pain, and the pain was worsened by eating, drinking, and on touch. She also had fever since 7 to 8 days. Then she complained of for vomiting episodes of 3 to 4 since 7 to 8 days. The vomitus character was large quantity containing undigestible food particles, vomiting immediately after eating. Gradually, she developed with the yellowish discoloration of face and extremities since 4 days. So onset reveals that if it's slow onset is there, so it is mainly seen in the infective or inflammatory disorders. If the onset is sudden, which is mainly seen in the inflammation which is due to the mechanical disorders, reasons can be biliary or ureteric stones, valvulus or adhesion, etc. She came with the she gave the history of patient ate Chinese food 10 to 15 days ago. After that, after 6 days, patient started with the complaints of epigastric region pain, of gripping pain, which worsened by eating, drinking, and on touch. On the next day, she's had 2 to 3 episodes of vomiting, also nausea before vomiting. Then her complaints increased gradually, slowly, vomiting immediately after eating anything. So vomit aggravated by eating, after eating. Vomitus character was large quantity containing undigestible food particles. Also had fever and gradually developed with the yellowish discoloration of face and extremities. Patient, we have also taken the negative history. Patient gave the negative history, she didn't have diarrhea. So diarrhea is mainly associated with vomiting. It is considered as suggests the gastrointestinal gastroenteritis disorders. And she also didn't have any radiating pain. So radiating pain to the right shoulder, which is seen in the acute cholecystitis. And if the pain is radiated to the back, it is seen in the pancreatitis, which is not present in this case. Then she also didn't had any history of dysphagia, which we can rule out the pathology of lower sphincter of the esophagus, as the patient complained of the epigastric region pain. Then also didn't had any history of bleeding, that is hematemesis or melena. There was no significant past history and family history present in this case. On general examination, build was lean. Her height is 5.6 feet, weight is 60 kgs, and BMI is 20.6. Uh, Pulse were 84 beats per minute and temperature was 99.4 degree Fahrenheit. Her BP was normal which was taken on the supine position of the right hand. Conjunctiva was pale. Sclera was yellow. Nail was yellow. So pallor was present. Icterus were present. Clubbing was absent. Clubbing is can be seen in the acute pancreatitis. So we can seen in that. Edema was absent. Tongue was clean tongue. Slight imprints of teeth were present. Dehydration signs were absent. As patient complained of the vomiting since 7 to 8 days, dehydration was checked. So to evaluate that, we have evaluated through skin, mucous membrane, eyes, then the capillary refilling time, and other signs and symptoms. On the abdominal examination, uh, the abdomen, we find mild distension, no scarring were present, no discoloration were present. As the discoloration, bluish discoloration is seen in the acute pancreatitis, that the sign is called as Cullen sign and Gray Turner sign, which was absent in this case. On palpation, rigidity was absent. On superficial palpation, tenderness at epigastric and right hypochondriac region was present. On deep palpation, liver was just palpable. Spleen is non-palpable here. Uh, Murphy's sign and Burst sign was absent, which are mainly present in the acute cholecystitis. On percussion, dull note was heard at the right hypochondriac region. Then on auscultation, the parasitic movements were heard normally. Uh, Other systemic examinations were normal. Differential diagnosis for this case were taken viral hepatitis, acute gastritis, food poisoning, acute cholecystitis, and acute pancreatitis, as patient complained for the epigastric region pain since just in acute period, and also the vomiting.
बद्दल ऑलरेडी झालंय त्यामुळे हा अवेअरनेस पकडून भारत सरकारनं प्रत्येक राज्याला लहानपणाच्या शाळेत
Investigation suggested to the patient were uh, complete blood count, liver function test, urine analysis, USG abdomen and pelvis, hepatitis A virus, antibody, and antibody screening. Here are the reports. CBC, urine analysis, serum creatine, which was normal, liver function test, USG, rapid antibody test, antibody screening of HIV. So the important parameters were seen in this all these reports were on complete blood count. WBC count was reduced 2100 per cubic mm. Then hemoglobin were also reduced A platelet count was also reduced. On urine analysis, urine color were yellow, bile salts absent, pigments absent, pus cell were present, protein were in trace amount was seen. Serum bilirubin was 2.5 mg%, which was slightly increased in this case. Direct bilirubin was increased. Indirect is also increased. 0.4 direct bilirubin was 0.448 mg% and indirect bilirubin was 1.02 mg%. SGOT and SGPT were also seen. SGOT is 250 international units per liter and SGPT 630 international units per liter. In this case, IgM was reactive, which reflects the recent infection, and HAV antibody was reactive. On USG gave the impressions of mild hepatosplenomegaly with pseudo thickening of gallbladder as described. A prominent cecum, ileocecal junction, and terminal ileum were inflamed, and solitary gallbladder or periportal nodes were seen inflammatory. This pathology is mainly because hepatitis directly don't affect the guts, but it damages the liver parenchyma. But the inflammatory changes, it also indirectly affects the guts, causing the colitis in the. And the final diagnosis was acute viral hepatitis. SGOT and SGPT suggested the liver damage, basically, and SGOT is also for the other systemic damages are also seen. So, thank you.
Thank you. Thank you so much, Sital. Please stay with us now to deliver expert opinion from our gastroenterologist, Dr. Pratibha Sonawne. Dr. Pratibha Sonawne, she is Associate Professor from Maharashtra Postgraduate Institute of Nashik.
Hello, good evening.
Good evening, ma'am.
Yes. As per the discussion, we are discussing about all the acute hepatitis. That is usually the clinical features will be presentation like acute abdominal pain. They will have nausea, vomiting, loss of appetite. Sometimes fever might be there. It may be high grade or low grade, associated with generalized symptoms like joint pain, generalized weakness, and decreased oral intake. So these are the common features of acute hepatitis, we can say, and commonly associated with nausea, vomiting, and loss of appetite. Okay. Then we have some associated feature which can give us a clue about the diagnosis. Like if there is associated fever, joint pain, that is called as a prodromal symptoms. If these are present, then likely to be a patient of viral hepatitis. Okay. The viruses could be HIV, HEV. It can be even a dengue virus. It could be a malarial infection. So even the other infections can also cause hepatitis or acute hepatitis. Then this has to be differentiated from biliary cholangitis, where patient will have similar presentation of abdominal pain, fever, loss of appetite. But in this case, usually there will be a high grade fever. So if the pain is more severe in the right hypochondrium or patient is having high grade fever, then we have to rule out the acute biliary cholangitis, which can also be a cause of the rapid rise in jaundice. Okay, rapid rise in bilirubin. So these two things we have to keep in mind. We have to differentiate it on history, if possible, and on examination. On examination, in acute hepatitis, usually patient will have icterus. Patient may have a slightly lower side blood pressure. So BP may be 90, 60 or 160 because of the vomiting and decreased oral intake. They may have pallor. Then additionally, if you do per abdominal examination, then there will be a palpable liver. Hepatomegaly is very, very common in this patient. It could be a tender hepatomegaly because of the acuteness of the disease. So acute viral hepatitis will cause hepatomegaly and tenderness will be there in the right hypochondriac region. on examination. In addition, you have to look for any features of liver failure, like presence of coagulopathy, encephalopathy, which is usually the complication of viral hepatitis. So look for the presence of flaps or irrelevant talk of the patient for hepatic encephalopathy. For coagulopathy, you can see the bleeding bruises or patches over the body. Then sometimes if it is a dengue hepatitis, you may get petechiae because of thrombocytopenia. So all these things should be examined carefully on general examination. Then moving to the investigations, as I told you, we have to differentiate from the biliary cholangitis. If a patient has a history of high-grade fever, abdominal pain, then do a USG abdomen along with all the blood tests. If the clinical feature are very classical of viral hepatitis, then you can wait for USG. You can go for blood test and then go for the diagnosis. You do CBC, liver function test, creatinine, and inflammatory markers if required, like CRP. If you are suspecting dengue, you can do a serological test for dengue, then serological test for malaria. This can also be done. IgM, HEV. This will help you to reach to a etiological factor for the cause of acute jaundice. Okay. And if ultrasonography shows hepatomegaly, it favors the diagnosis of acute viral hepatitis. Now, sometimes if there is obstruction, like in biliary cholangitis, then on ultrasonography, you can find out dilated CBD, dilated IHBR. These are the findings which gives you a clue. Now, this is very important because in this patient, emergency operative procedure may be required, like they may require an ERCP. So, it is necessary to differentiate on clinical feature examination and ultrasonography. Then liver function test will show elevated liver enzymes, SGOT, SGPT in viral hepatitis. In obstruction, there will be additional raised of alkaline phosphatase might be there. Okay, which again gives you a clue that the patient may have some obstruction. Then if you do a CBC, if it is a viral, there may be leukopenia, there may be thrombocytopenia. If it is malarial, then hemoglobin may be normal, but hemoglobin and WBCs are usually normal, but platelets will be low. And on peripheral smear examination, you can see the vivax or falciparum malarial parasite can be seen. So these are the tests which should be done for treatment. Usually, acute hepatitis requires supportive care. That is a good diet, which should be rich in carbohydrate. They are prone for hypoglycemia. Because of loss of appetite, the oral intake is very poor. So encourage them to eat more small frequent meals, have more liquids, which is easily digestible. Then second, for drugs, you can give liver supportive medications like ursodeoxycholic acid. You can give supportive medication for nausea, vomiting in the form of phantom PPIs and antiemetic measures so as to decrease the nausea and vomiting and improve their oral intake. So usually this supportive care is given and we have to monitor the liver function test. If patient is improving, then much interventions are not required. Few patients who develop complications like coagulopathy, encephalopathy, they may have to be managed in the ICU setup. They may develop a rise in creatinine levels, so they will require more critical monitoring. Okay. I think I have covered most of the points.
Okay, ma'am. Okay. Is there any limitation to treat such kind of cases?
Sorry?
Is there any limitation to treat such cases?
No, generally with this clinical background and investigation, we could reach to a final diagnosis. Sometimes it may be a rare disease presenting first time, like autoimmune hepatitis, Wilson's disease. In that cases, sometimes we may have difficulty, but after evaluation, if there is a jaundice, persistent jaundice, then we do workup for these diseases and reach to the diagnosis.
Okay, okay, ma'am.
Yes.
Thank you so much. Please stay with
Thank
us.
you.
Yeah. Now next expert is from Ayurveda, Dr. Sachin Patil, sir. Dr. Sachin Patil, he is principal.
Yes, ma'am.
Yes, sir. He is principal and VP of Kai Chikitsa department from Sumati Bhai Shah Ayurved College, Hadapsar, Pune. Welcome, sir.
Thank you, ma'am. Yes, ma'am.
So you can start your opinion. Are you sharing your slides?
Can I share, ma'am?
Yeah, please share, sir.
In WhatsApp. I will.
May I help you, sir, to share your slides? I have your PPT, so I can share from this side also.
Please share, ma'am. Please share.
Okay. Is it visible?
Yes.
Okay.
Visible, ma'am.
Okay, sir.
Yes. Today's topic is acute liver diseases and their management in Ayurveda. Yes. Am I audible, ma'am? Next. Next, ma'am. Yes. Introduction. It's organ is involved liver. There is a metabolic disorder in Ayurveda. There is a term jaundice and Kamala, which is explained in Ayurveda. There is a Ekruta Kshaya, and we can compare with the modern science the liver cirrhosis. Ekrut Ruddhi means hepatomegaly. Secondly, Ekruta Shota. This is a hepatitis. There is a viral infection. In Ekrut Shot, non-alcoholic steatohepatitis. In Ayurveda, the basic Tridosha Saptadhatu and Trimal, imbalance of Dosha Dhatu Mala in this liver disorder. Liver disease here mentioned here, the sudden onset of hepatic dysfunction less than 6 months, features jaundice, coagulopathy, hepatic encephalopathy, and elevated enzymes. Causes of liver disease, it's infectious, hepatitis A, hepatitis B, hepatitis E. It may cause due to the viral infection. Another cause is the drug toxicity. Whenever the drug acetaminophen and other drugs are overdosed. And
Sir,
autoimmune disorder.
just a minute, sir. Sir, we are expecting only Ayurveda explanation or Ayurveda expert opinion from you. Because
Okay.
part is explained by Dr. Pratibha
Right.
and Dr. Sheetal.
Ma'am, you should go ahead. Line of treatment.
Nidan.
And okay. In Ayurvedic perspective, there is a hetu mentioned, nidana, which is the causative factors are the spicy food, oily food. Next, another part is the consumption of alcohol, madhya sevana, and other cause is the creamy. We can include in viral infections also. Emotional stress, it is also the one of the cause, the Manasik Nidana. The cause is the Garoda. Next slide is, ma'am, line of treatment. Ayurvedic management principle is, there is a basic is the imbalance in the dosha dhatu mala. Our to balance the pitta dosha. Detoxification should be done by the pancharma process. We should use the virechana therapeutic purgation. It is useful to detoxify the patient. Another treatment part is the Raktamokshana, bloodletting, and Rasana therapy, which is used for regeneration. The liver cells should be regenerate. The classical formulation for to treat the patient is the Arogyavardhini Vatti for Yakrut Vikara. Second, Puranavadi Mandur to treat the Kamala and anemia, and Phalatrikadikvat is used to liver detoxification. Yakrut Churna boosts the digestion, and Bringraj Asav should use the liver tonic. In day-to-day practice, syrup Liu 52 should also use 20 ml TDS, Kumari Asav 20 ml BD, Vanodan Kal. Important Ayurvedic herbs. Generally, we should use the Bhumyamalki, which act as a hepatoprotective and antiviral action. Calmec drug is used bitter tonic, but detoxifier. Kutki also useful to balance the pitta pacification and promote the bile. And Triphala Churna used for the gentle detoxification and antioxidant activity. And Guduchi is immunomodulator drug. It's very useful. Diet and lifestyle to prevent the liver disorder. The pathya is recommended. Light food, moong dal, rice, gruel, coconut water, buttermilk, turmeric, and neem. It is also useful. Apathya means to avoid fried, oily food, red meat, alcohol, and stress. It is a guideline given in Ayurveda. It is very useful to treat the patient. Modern supportive care, already we listen by the faculty. Is the integrative approach should be there. Combine Ayurveda and allopathy treatment we can use. Supported diet, pathya, and Ayurvedic herbs should be used. Focus on the long-term liver health and to boost the immunity. It's a Santarpanjanya Vyadhi, so we can use the correlate with modern steatohepatitis, Vataja Yakrut Vruddhi, hepatomegaly, Apatarjan Vyadhi, Vataja Yakrut Kshaya. It means liver cirrhosis. We can compare it. So we can use the treatment mentioned above in PPT. Virechana is the most important thing. Thank you very much. The reference are explained in Charak Samhita, Ashtang Hruday, and WHO liver reports also. There is a Ayurvedic formulation invented as a very useful to treat this acute liver disorder. Thank you.
Okay, sir. Thank you so much. So, as per Ayurveda, as we seen in the slides, observe that preventive aspect is measured from Ayurveda. You should follow your diet and lifestyle to cure liver diseases. Then There are some treatments like Virechan, which is mainly for liver diseases. And thank you so much, sir, for your Ayurveda perspective. Now, for homeopath, we have Dr. Meeta Gharte. Ma'am? Dr. Meeta Gharte, ma'am?
Hello,
Yes, ma'am.
good evening, everybody.
Good evening, ma'am.
One sec.
Ma'am is Vice Principal of Department, Vice Principal, and she is from Department of Pediatric from Motiwala Homeopathic Medical College, Nashik.
Good evening, ma'am, and thank you first of all for inviting me for this discussion. And thank you, Sheetal, for the case presentation. Ma'am, to start with, I wanted to share my slide. So, should I?
Yeah.
Is my slide visible, ma'am?
Yes, your slides are visible, ma'am.
Okay. So in this diagnosed case of hepatitis A viral, hepatitis caused due to hepatitis A virus, I would like to talk on the homeopathic approach to this case. First of all, let me talk about the understanding of case according to homeopathic perspective. So, HIV infection is actually a self-limiting disease, and there is a spontaneous remission. And once this disease occurs, it gives lifelong immunity. And this disease takes at least 3 to 6 months for complete resolution. There are symptoms like nausea, vomiting, fever, pain in abdomen, which actually trouble the patient. Conventional line of treatment does not offer any specific treatment for viral hepatitis, specifically hepatitis A virus, and hence many of the patients resume to alternative line of treatment like Ayurveda and homeopathy. And here comes the role of homeopathy. To understand this case, we would classify this case as an acute case, which is caused due to eating outside food, that is telluric cause. If we go to the more specificity, then this is a acute case of sporadic nature according to Master Hahnemann's classification of disease. And patient here suffers from symptom complex because which is a result of host's individual cellular immune response to liver injury that is caused due to opportunistic organism, that is hepatitis A virus, because hepatitis A virus is not known to cause infection or symptoms to all the patients who come across or who are being exposed to this virus. Many of the times children escape from this infection. Susceptible people usually get this type of infection. People who with lower immunity usually show the symptom, and people with very less immunity usually go into complication. Otherwise, resolution takes place. Hence, it basically depends upon our own immune mechanism, that how it is responding to the organism. Hence, every patient will exhibit his own response, and every patient will have his own, a few of his own symptoms which are against the defense to this virus. And hence, though all the patients suffer from few common symptoms like pain in abdomen, fever, or nausea, vomiting, icterus, there will be some other individual symptoms of the patient, and here lies the homeopathy. According to principles of homeopathy, we do not treat only the symptoms of the disease, but we treat all the features that patient suffers from, all the disturbances that patient suffers from when he is in disease state, which we call it as individualization. And on basis of all these symptoms, we form a totality which is called as totality of symptom, and we apply principle of like cure like. That is, we will take all the symptoms of the patient, we will match it with the drug symptom, and the drug, we have more than 3000 remedies in homeopathy. So we try to match those drug symptoms with the symptom that patient is suffering from when he is diseased, and that remedy becomes his individualized homeopathic remedy. That is the principle that we use, and the same principle we will be using for hepatitis A infection. Since it is an acute infection, we will be forming an acute totality in this case. Now, the data that was provided by Dr. Sheetal in her case is not sufficient for me to make a homeopathic prescription, because apart from the disease symptom investigations that she talked about, I also require some more symptoms. Like here, I would like to know that when your patient has this hepatitis A infection, then during this phase, is there any deviation in her mental state, her mood? Is there any deviation in her general state? That means, how is her appetite affected? How is her sleep affected? Are there changes in her bowel habits? Are there changes in her bladder habits? How is her thermal state during this disease time? Are there any symptoms which are, are there any factors which are causing aggravation of her symptoms, or are there any factors which are causing amelioration of her symptoms? So all these features are essential for me to construct a picture of disease so that I can make prescription on it. So this data was basically insufficient for a homeopath to prescribe. Our history taking will be more detailed than this, as I told you. Now, if suppose I have selected the remedy on the basis of my complete totality of symptom, then what do I expect from my remedy in case of hepatitis A? I'm saying this because this is a viral disease and it is known to resolve by its own. Then what can homeopathy do over here? So now I expect that my remedy should improve quality of the life of patient during the phase of disease. That means his symptoms like nausea, pain in abdomen, weakness, appetite loss, if any, should be relieved. Liver function should improve. Her immune response should be enhanced, and the duration of duration of cure, which we said normally is 6 months to 3 months, depending upon the patient's response, this period should be minimized. That is what I expect from my remedy. Now, what are the possible remedies that could be used in case of hepatitis A infection? So there are many remedies like Nux vomica, Lycopodium, Phosphorus, Bryonia alba, some organ-specific remedies like Chilidonia majus and Cardus marinus, which we can use in case of hepatitis A infection. I will give few indications of these remedies. If I have to use Nux vomica, then the key indications of Nux vomica would be when a person has overindulgence into anything, that is overindulgence into spicy food, overindulgence into alcohol, or he has taken a lot of medicine and after this the disease has started. If suppose his temperament during the time of disease has become very irritable, if there is constant nausea resulting into vomiting, if he cannot pass his stools properly, there is a sensation of incomplete passage of stools, then Nux vomica is a very good remedy, especially in the early stages of liver inflammation. Nux vomica acts very well. Another remedy of great use is phosphorus. Indications of phosphorus are when there is great weakness associated with hepatitis infection, if there is easy tendency to bleed, if there is intense thirst, especially for the cold water, and when he loves to take ice creams, fruits, cold water, but when this cold water he drinks and will go into the stomach, become hot, then he vomits it out. When there is anxiety associated with disease, And especially this remedy will be useful when patient is going into complications of hepatocellular failure. Lycopodium is another remedy that is of great use. When there is bloating, flatulence, indigestion as a prominent feature during this disease time, when his symptoms are getting aggravated from 4 p.m. to 8 p.m. and there is pain on right side, other complaints which are associated with liver complaints are also right-sided, then lycopodium comes to use. Then Bryonia alba, some key indications of Bryonia alba are when there is sharp stitching type of pain on right side, when that is at the site of liver, when the mouth becomes very dry, patient has insatiable thirst and takes large quantity of water, when inflammation is still acute in origin, recent in origin, then Bryonia alba comes to an help. Another remedy, which is more of a syphilitic remedy, where severity of symptom is more, is Merck salt. Offensiveness is marked in Merck salt. Everything has to be offensive in Merck salt. Vomiting is offensive. Stools are offensive. Perspiration is offensive. Along with this, there is profuse salivation and jaundice, and in Merck salt, symptoms are aggravated at night. So these are some of the key indicators of the remedy. But of course, remedy has to be prescribed on acute totality of symptom, that is deviation of his physical and mental state during the time of disease. Occasionally, it happens that we do not get a very good individual symptoms on which we can prescribe. Maybe because the susceptibility of patient is low, and then we will have to resort to organ-specific remedies. Chelidonium is one such remedy which can use in both ways. It can be used as a individualized remedy. Also, in the cases where we do not get peculiar symptom or a good totality of symptom, it can be used as an organ-specific remedy. Chelidonium is one of the very important remedy in case of hepatitis A infection. It is called as liver tonic of homeopathy. Here, liver affections are associated with radiating pain in right scapula. Tongue is yellow coated, extreme bitterness of mouth, constipation with clay-colored stool. Patient is worse from motion and he is better by warm food and warm drinks. Another very important remedy where both liver as well as gallbladder are affected is Cardus marinus. This can also be used as an organ-specific remedy. Especially when there is enlarged liver and there is vomiting of green colored bile. In what dosages should we use these remedies? So if you have got a good totality of symptom, that means that the patient has good susceptibility and susceptibility is high, and he is, I should not say good susceptibility, he has altered susceptibility, but susceptibility is high and he is able to manifest many symptoms, then here we can go for higher potency or strength. And when we are using higher remedy in higher potency, then frequent repetition is not needed. You can repeat the remedy infrequently. If suppose susceptibility is low, if we are not getting very good set of symptoms, then lower potency should be resorted. If we are using organ specific remedies, then here ideally lower potencies should be used, because we are targeting on the physiological action of remedy, and hence lower potencies should be used, or mother tinctures should be used. More the remedy similar to the disease, higher the potency we can choose for. Higher the potency we are using, we need to repeat it less frequently. Along with the remedy, we will have to give some supportive management also. That is, patient should be well hydrated. Patient should take a lot of carbohydrates, as ma'am said, especially glucose. Then non-fatty, light diet should be given. Rest is very important. Hygiene should be maintained, and we should keep on monitoring liver enzyme. In spite of our treatment, if suppose SGOT, SGPT is on rise or serum bilirubin is increasing or icterus is deepening, then in such cases it is better to refer the patient to the main line of treatment. And you should also give some adjuvant advices, like a patient should avoid alcohol. Then hygiene is very important because it is a communicable disease and it spreads through fecal-oral route. So if one person in the family is affected, it is quite likely that others can also be affected, and hence hygiene is very important to prevent this infection to the other members of the family as well as in the society. And of course, family screening also should be done, since it is possible that they all may have been got the infection. So this was about homeopathic approach to this case of hepatitis A. Thank you.
Thank you so much, ma'am. You have presented in detail, and it is very helpful to understand homeopathic thought process while treating such kind of patients. So mainly homeopathic treatment varies with physical as well as mental signs and symptoms, right?
Right.
So other methods should also focus on this point. Thank you so much, ma'am.
Thank you.
Now, is there any query from participant? Today we have very large gathering of participant. So, is there any query? Okay, so we can stop here. Thank you so much. First of all, thanks to Dr. Sheetal, then Dr. Pratibha, Dr. Sachin Patil sir, Dr. Nita Gharte, and audience. Thank you so much for your participation, and you may suggest next topic or next meeting in chat box. Thank you.
Thank you, madam.
Thank you, sir.
Okay, okay. Thank you.